When you go to a doctor for the complaint of neck pain, the doctor first tries to identify what the cause of the pain is, whether it is from a musculoskeletal origin or whether it is a referred pain. The very common problems that shows neck pain as one of its symptoms is cervical spondylosis. It is a wear and tear of joints, wherein there is also dryness of the intervertebral disc. So as a result, there is severe pain, there is stiffness in the joints, the movement of the neck is restricted. When the dryness of these joints are very worse, especially in the first two vertebrae, people also do have complaints of giddiness that lasts for about 2 to 3 seconds only, especially with change in postures. Yet another problem which is very commonly found regarding the neck is the cervical disc bulge. Here the intervertebral disc, that is a cushion-like structure which contains the outer fibrous ring and inner jelly-like material. The outer fibrous ring breaks off and the jelly-like material is pushed off. So this can compress any of the nerves that are emerging from the cervical region. This can lead to tingling sensation or numbness in the hands, as well as shooting pain in either of the hands or maybe in the both hands. Certain inflammatory conditions like cervical spondylitis also have neck pain as one of its main symptoms. Similarly, muscle spasms or muscle sprain, fibromyalgia, wherein the muscle fibers become a little thickened like coir. These are all common conditions associated with neck pain. Sometimes there won't be any problem with the muscle or bones. The pain will be a referred pain. Usually we do find in clinical practice that people who have gastritis kind of problems do complain of neck pain. Neck pain is also associated with certain infections like in meningitis. The treatment of neck pain involves not merely popping in a pill and then making the nerves numb and finally carrying on with the daily routine. Ayurvedic treatment protocol involves understanding what the cause of the disease is and then prescribing specific treatments which involves therapies, medications, diet and lifestyle corrections. Regarding therapies, first it is understood whether the disease is due to any kind of musculoskeletal injury or it is due to any kind of dryness in the muscles and bones, or if it is inflammatory condition. Based on that, certain treatment procedures will be recommended. For example, fermentation therapies, which we call as kiri, or it can be pirchal, that is continuous pouring of medicinal oil in that area, warm, or it can be even pichu, a cotton dipped in that oil, keeping on that area for a certain duration, or it can also be lepam, that is medicinal paste application. Certain therapies like Griva Vasti are more specific for these kind of problems, that is stagnating the oil for a specific duration in the cervical region. Certain treatments like Nasyam, that is installation of nasal drops, are also very important in these kind of conditions. This is supplemented with certain internal medications which help in correcting the damages that has happened to the muscles and bones area. Diets do play a vital role when the cause of the problem is a referred pain, like say when the gastritis is a problem, then specific diet protocols are given. But when it comes to the musculoskeletal problems or where the cause is an injury, there in fact diet has very less importance, but still it is recommended to avoid curd during night as well as to avoid cold items. Now regarding lifestyle changes, the first and foremost thing is to maintain the right postures when you are sitting or when you are standing. Similarly, using pillows of the right size is very important. When you are lying on your back, it is recommended to either avoid a pillow or use a very thin pillow, but still the pillow has to be pulled down to the shoulder region so that it doesn't strain the neck. And if you are lying on sides, ensure that you use a pillow which makes you comfortable in such a way that your neck is always erect and it's not tilted. Apart from this, certain exercises are also recommended in these kind of problems. The duration of therapies might be for about 7 days or 14 days, or in worst cases, it can extend to 21 days. But internal medicines, diet, and lifestyle changes have to be continued for a longer duration. With this, definitely you will get good results. In fact, we have got a lot of cases wherein surgery was indicated, and then after treatment, surgery, they didn't have to go for surgery. Similarly, people who have already undergone surgery, when they had certain complications like the stiffness was persisting, the range of movement of neck was reduced, all these could be treated with Ayurvedic therapies. Now, apart from this, the most important fact in this is the maintenance therapy. Because once you finish the treatments, you are free from the pain. You are going back to the same kind of lifestyle, the same kind of job, wherein it is very much common that when you are involved in a job, you literally forget the posture you are maintaining. Similarly, the travel is also a part of our life. So then the chances of these kind of muscle strain and wear and tear of bones are expected. So maintenance therapies lasting for about 3 days or 5 days or max to max 7 days, the person will have to take maybe once in 3 months or once in 6 months. In this way, tactfully, if you are taking care of your neck pain problem, you can definitely get good results with Ayurvedic therapies.